Hello everyone. So this video is about Coombs test. Coombs test is actually an antigen antibody reaction test that detects anti-RBC antibody by using a reagent Coombs reagent. Understanding anti-RBC antibody gives us the basic of this Coombs test. Now anti-RBC antibody can be of two types. Either they can be agglutinating antibody or non-agglutinating. When we talk about agglutinating antibody, we are talking about an IgM antibody. These IgM antibodies have 10 sites for binding. They are pentameric. Means a single molecule of IgM is going to bind to 5 RBCs and going to bring about agglutination by its own with no need of anything else. Whereas when we talk about non-agglutinating antibody, these are IgG. A single molecule of IgG can bind to a single RBC. So they cannot bring about agglutination by their own. So we are going to need something else, and that is Coombs reagent. So when we say antigen antibody reaction test meant to detect anti-RBC antibody, here we are trying to talk about non-agglutinating antibody that are IgG. IgM do not need detection by Coombs reagent. So anti-RBC antibody we are trying to detect by Coombs reagent are non-agglutinating antibody, and these are IgG. Now these IgM antibodies were anti-A and anti-B. These anti-A antibodies are one which are found in B blood group, and anti-B antibodies found in A blood group. Means ABO blood grouping have agglutinating antibodies. They do not need Coombs reagent. Whereas when we talk about RH grouping, these anti-D antibodies are IgG. Means to detect these anti-D antibodies, we are going to need Coombs reagent. So this form the basics of this test, why we are trying to do Coombs test. Now after understanding this, we are going to try to understand direct agglutination and indirect agglutination test. In direct agglutination test, we are trying to detect antibodies that are present already in the RBC surface. Okay, so we are going to take patient's blood. We are going to filter this blood so that we wash off the plasma, and only the antibodies that are present over the surface of RBCs are detected. So in direct agglutination test, we are going to detect only the antibodies which are already present on the surface of RBC. And this is the basis of direct agglutination test. These antibodies that are present on the surface of RBC cannot bring about agglutination by their own. So we are going to add this green colored Coombs reagent that is actually an anti-IgG antibody. Okay, human derived anti-IgG antibody, an antibody against IgG molecules. This is going to clump together the RBC and bring about agglutination. So direct agglutination test is going to detect antibody that are present over the surface of RBC. So direct agglutination test is meant to detect autoimmune hemolytic anemias. Not only this, direct agglutination test in blood, Coombs reagent can be made as a cocktail. Means not only an anti-IgG antibody is added, a C3b molecule antibody is also added in this Coombs reagent. What is the advantage? By adding this C3b antibody, we can also detect complement deficiencies. So direct agglutination test is meant to detect autoimmune hemolytic anemias as well as complement deficiencies. Talking about an indirect agglutination test, which is more commonly used. And why this is so? Because it has an important role in pre-transfusion as well as in prenatal testing in pregnant women. How so? So here we are going to take two things: a recipient plasma. Here take a pregnant mother. That is, in the recipient plasma we are going to have, if we have antibodies, we are going to check for it, and we are going to take test RBCs or donor RBCs which the mother is going to receive. And to this we are going to add Coombs reagent. If there is any agglutination seen, it means that recipient plasma had antibodies against the donor RBCs, giving rise to agglutination, and that is a positive indirect agglutination test. By this positive indirect agglutination test, we get to know that recipient plasma had antibody against the RBC which he or she is going to receive. This can happen in conditions like if the patient is receiving blood group with receiving another anti-D blood group will lead to a reaction in recipient plasma, or in prenatal pregnancy testing we can get the same thing. So at last, summarizing it, direct agglutination test detects antibody or complement protein C3b attached to RBC. Okay, whereas indirect agglutination test detects antibodies which are against antibodies against foreign RBCs. Okay, where in direct agglutination test we are going to use wash RBC without plasma, whereas in indirect agglutination test we already discussed we are using recipient plasma. DAT uses in autoimmune hemolytic anemias as well as complement deficiencies, whereas IAT role comes in prior to blood transfusion, means pre-transfusion, as well as prenatal testing of a pregnant woman. Hope you understand this topic. Thanks for watching.